This is your SGC with Adiola, and in today's topic, we are going to be talking about stroke. Last time we discussed about hypertension, which can also lead to stroke. So, in today's topic, we will be talking about stroke, which is also called cerebrovascular accident. What is stroke? Stroke is the damage to the brain from interruption of its blood supply. Stroke occurs due to decrease in oxygen to the brain. This can be due to bleed or blockage in the brain's blood supply. Immediate emergency treatment may help prevent life-threatening consequences. There are three main types of stroke. You have ischemic stroke, hemorrhagic stroke, and transient ischemic attack. Ischemic stroke, this is the most common type of stroke, making up 89% of all cases. A blood clot prevents blood and oxygen from reaching an area of the brain. Hemorrhagic stroke, this occurs when a blood vessel ruptures. These are usually the result of arteriovenous malfunctions. Trans Transient ischemic attack, this occur when the blood flow to a part of the brain is inadequate for a brief period of time. Normalize Normal blood flow resume after a short amount of time, and the symptoms resolve without treatment. Some people call this mini stroke. What are the risk factor? You have lifestyle. Number one, lifestyle. Poor diet, high blood pressure, smoking, physical inactivity, and drinking too much alcohol can increase the stroke. Medical condition: diabetes, high blood pressure, cholesterol, heart disease, and atrial fibrillation can also increase the risk of stroke. Family history and genetics can play a role in stroke risk. Age and sex: the risk of stroke increase with age, and stroke appear to be more common in females. A history of transient ischemic attack (ITAs), also known as mini stroke, can increase the risk of stroke. A high red blood cell count may also increase risk of stroke. What are the causes? Diabetes, high blood pressure, smoking. High blood pressure of 140/90 per mercury or higher. Alcohol use disorder, obesity, atrial fibrillation, age, ethnic family history of stroke, heart disease, inactivity, poor malnutrition, microvascular ischemic disease, stress, sickle cell disease, blood thinning medication, recreational drug use. Using recreational drugs like cocaine can increase the risk of stroke. So what are the symptoms? The most common symptoms of stroke are: one, face dropping. Ask the person to smile and look for dropping. Arm weakness. Ask the person raise both arms and look for weakness or sagging. Speech difficulty. Ask the person to say a simple phrase and listen to blood or strange sound words. Sudden numbness or weakness. This occur in the face, arm and leg, especially on one side of the body. Sudden trouble seeing. This occur in one or both eyes. Sudden trouble walking. This can include dizziness, loss of balance, or lack of coordination. Sudden severe headache. This should have this should have no known cause. Symptoms can vary from person to person and often happen suddenly. The types of symptoms depend on the stroke and the area of the brain affected. Then the test, number one, image imaging test. This can help detect the type of stroke and when it occurs in the brain. We have computerized tomography CT scan uses X-ray to create detailed picture of the brain. We have magnetic resonance imaging MRI uses radio waves and magnets to create pictures of the brain. We have digital subtraction angiography looking for narrow blood vessel in the neck. Position emission tomography. Then we have blood test. This can check for signs of heart damage or infection. Clotting ability, blood sugar level, and kidney and liver function test. Electrocardiography, ECG or EKG. This test detect and record the heart electrical activity. 4. Carotid ultrasound uses sound waves to create picture of the carotid arteries which supply blood to the brain. Transcranial Doppler ultrasound uses sound waves to measure blood flow and help determine which artery in the brain is blocked. Electroencephalography. This test is less common and can rule out seizures or related problems. If you or someone else experience signs of stroke, call emergency service immediately. Treatment starts the sooner the better chance of the survival and successful rehabilitation treatment. The best treatment for stroke depends on the type of stroke. Tissue plas plasminogen activator (TPA) is a medication that breaks up blood clots that block blood flow to the brain. Other medications, we have surgery. In some cases, surgery may be required to remove blood clots. Therapy after a stroke. Therapies as speech therapy, physical therapy, and occupational therapy can help with a variety of issues, including communication, movements of daily activity. Support groups. Joining a support group can help people cope with mental health issues that can occur after a stroke. Technology assisted physical activity. This activity can help retain muscle and improve limb function. Examples include function electrical stimulation, robotic technology, wireless technology, and virtual reality. So I hope you found this interesting. If I'm too fast in this video, please you can go back and rewatch again. Thank you for watching today's episode. Till I see you in my next video. Thank you and God bless. Bye.